The stakes for having a total hip replacement surgery are high for everyone. For young people with congenital hypoplasia or post-traumatic arthritis of the hip, they're even higher. After all, the longer you live after the joint replacement surgery, the more time there is for all kinds of problems to catch up with you. So I'm here to give you all the information that you need to get the very best hip replacement available today. Spoiler alert, it's all about the surgeon. The most important thing you can do to ensure a successful hip replacement is to pick the right surgeon. But how do you even do that? To find the right joint replacement surgeon, there are 3 things that you need to know. Let's unpack each of them one at a time. First, pick your approach first. There are 3 surgical approaches that you can choose from. They're the posterior, anterior, and lateral. But only 2 out of those 3 are best practice. Posterior is the legacy approach that nobody needs anymore. It has a longer recovery during which you can literally barely walk. It permanently weakens your hip and leads to permanent restrictions, and it can literally require years for you to regain full strength. There are 3 really great minimally invasive approaches to total hip replacement surgery. There's the lateral, which means from the side. That one comes in 2 different flavors. It's direct superior and superpath. The other good approach is anterior, which means from the front. As of today, I really don't see any compelling evidence that one of these minimally invasive approaches is actually better than the other 2. So if you find a surgeon you like and they do the anterior, direct superior, or superpath approach, you're good to go. No matter how much you like the surgeon, if all they do is the posterior, find another surgeon. Second, the data's still coming in, but as of today, I personally would not have total hip replacement surgery without a robotic assistant. Let me tell you why. Robotic assistance increases surgeon accuracy by 400%. But the real reason, the even more important reason, is the implant selection. During surgery, the surgeon uses the robot to create a mathematical model of your hip. They then can use the computer model to predict the best parts and size of those parts to give you the perfect range of motion with correction of any deformity. Third, get the procedure done in an ambulatory surgery center. Hospitals are chock full of COVID, medical mistakes, and legacy orthopedic surgeons who still think it's okay to do your mother's total hip replacement using the old posterior approach. When celebrities like Kris Jenner need hip replacement surgery, they get it done in the luxury, safety, and convenience of an ambulatory surgery center. You should too. To summarize, you need to find an orthopedic surgeon who does the anterior, direct superior, or superpath approach with a robotic assistant in an ambulatory surgery facility. Chances are they are going to be a high-volume joint replacement surgeon, which cuts your chances of a serious complication in half. And since they use the robot, they're locked into top-rated, registry-proven implants. For best practice, I'm Dr. Dan Lieberman. If you have a question you would like answered on Best Practice Live, click the link to our website and complete the submission form. The more information you can give us, the better we can answer your question. So please contact us and we can walk you through uploading your imaging to a secure server. Please like and subscribe to our channel to stay up to date with information about your spine and joint health.